Hello. Have you ever wondered what are the issues related to elderly? If not, let's start.
What are Geriatric giants, you say? Geriatric giant concept was developed by Professor Bernard Isaac in 1965. Geriatric giant refers to the indication of major or common illness or impairment that is associated with older people, to which the nine eyes of a geriatric giant was created. These conditions are immobility, instability, incontinence, impaired intellectual iatrogenesis, incoherence, insulin resistance, inanition, and impoverishment. By using the concept of geriatric giant, we will be able to identify the elderly syndrome to which intervention can be implemented to either reduce or delay the onset. This can be screened using the screening tools such as the Vital Index, CATS Activities of Daily Living, Dobton Instrumental Activities of Daily Living, Mini Mental Status Examination, Geriatric Depression Scale, and many others. And in 2015, a rapid geriatric assessment was developed that allows rapid screening to be done. The COVID-19 pandemic has become the greatest challenge to the healthcare system, and it is greatly impacting the older patients. During this time, the interventions or treatment that is supposed to be implemented are being delayed as the majority of resources were transferred to the acute management of coronavirus. The effect can be seen through the postponement of elective surgical procedures such as total hip replacement or knee replacement that could help in improving older patients' mobility and pain control. Secondly, is through the delay of outpatient medical services, to which the assessment and the consultation is done virtually. And lastly, is the decrease of social supports toward the elderly, in which the provided social support helps in reducing pressure on secondary care facilities while also maintaining the patient's independence in their own home.
Stability. Let's take a look together. What is that? Stability is a condition when we cannot maintain our posture control, balance, and equilibrium. System involves somatosensory, vestibular system, and visual system. If you lose the ability to maintain your balance, you will fall. So fall is an event which results a person coming down to a lower level. According to WHO, around 684,000 individuals die from falls globally, and 37.3 million falls that are severe each year. We need to know how to maintain our COG within POS, and we need to know about limits of stability. Do you have muscle weakness? Do you always drink alcohol? Or do you might have sensory impairment? Any condition, medication that cause you unstable? Or you feel dizzy from sitting to standing? Or you move in uneven surface? Alright, if you have these problems, be careful. This is the risk factors of fall. What can you do? I provide to you some recommendation from WHO: training, home assessment and modification, vitamin D supplements, and Tai Chi. What do you think about pandemic COVID-19 and physical health? So, a narrative study by Loyola et al. 2020 stated that COVID-19 pandemic could lead to negative consequences for the physical health of older adults. Other main outcomes reported is anxiety, depression, and etc. Let's move to the next.
We move on to incontinence. What is incontinence? Incontinence is uncontrolled involuntary leakage of urine or inability to get to the toilet in time. It is a highly prevalent condition in older people aged 60 years and over based on WHO World Health Organization. Its prevalence range from 9.9% to 36.1% and twice higher in older women than older men. So, who at risk of incontinence? People with chronic conditions such as diabetes mellitus, Parkinson's disease, dementia, stroke, prostate cancer, COPD, and arthritis. Also, people with absence of caregiver for toileting assistance and inaccessible for unsafe toilet facilities.
Types of urinary incontinence. First, stress incontinence. With this type, weakened pelvic muscle flow causes urine to leak. This may be due to extra pressure placed on the bladder. This is the most common type of incontinence.
Stress incontinence may be triggered by coughing, laughing, or sneezing, exercises, or heavy lifting. Urge incontinence or overactive bladder. In this type, sudden involuntary contraction of muscular wall of bladder causes an intense urge to urinate, so they must go now or cannot make it to the toilet. Overflow incontinence. With this type, bladder cannot hold as much as urine as the body is making. The bladder doesn't completely emptying, causing small amount of leakage. Functional incontinence. With this type, a person recognizes the need to urinate but cannot make it in time due to physical or cognitive impairments. For example, people with dementia, depression, or arthritis. Mixed incontinence. People with this type experiencing more than one type of urinary incontinence. Many women have both stress and urge incontinence. These are the causes of acute incontinence and also persistent urinary incontinence. The primary goals of urinary incontinence intervention is to improve continence by having for muscle training, bladder training, and habit retraining, time or prompt voiding. Based on the article by Muhammad 2021, it seems COVID-19 by inflammation and demyelination in the pudendal nerve causes bladder and bowel incontinence.
Intellectual impairment. Today we're going to talk about MCI and dementia. So it basically involves the individual having impairment of general mental abilities like learning, attention. So what is MCI? MCI is the stage between expected cognitive decline of normal aging and the more serious decline of dementia. It's characterized by problems with memory, language, thinking, and judgment. What are the signs? If you're always losing things, forgetting events, and having more trouble with words, I think you need to find a doctor because it's my early sign of dementia. So what is dementia? Dementia is a progressive deterioration in intellectual abilities that interferes with social and occupational functioning. Let's take a look at the sign and stage. Early stage, we might become forgetfulness in everything, losing track of time, lost in familiar place. Middle stage, it keep worsen and need assistance with personal care and might having behavior changes. Late stage, you are unaware with the surrounding and increasing need for assisted self-care and experiencing more behavior changes. Here you can see the several types of dementia and the common one is Alzheimer's disease. Treatment depends on its cause. There is no cure or no treatment that slows or stops progression. But there are drug treatments that may temporarily improve symptoms. Try to get to sleep, avoid alcohol and smoking, socializing, exercise, nutrient-rich diet. This will prevent you from getting dementia or keep worsening. How about pandemic COVID-19 and cognitive impairment? Is there any effect? So, a study stated that neuropsychiatric symptoms of dementia during COVID-19 appear to arise from social restriction occurring as a consequence of the pandemic. So, it's affect our cognitive as well. So, we need to stay healthy.
Iatrogenesis. So, do you know that iatrogenic comes from Greek language? Iatros means doctor or healer, while genon means as a result. That's why it means as a result of a doctor. For your better understanding, according to the World Health Organization, iatrogenic disease may be defined as adverse drug reaction or complication induced by non-drug medical intervention. Guys, what are the risk factors? Always remember, the risk of iatrogenesis in individuals over the age of 65 is twice from the younger person. Other than that, taking multiple drugs, multiple chronic diseases, and person that exposed to the infection while hospitalized and medical procedures can be the risk of iatrogenesis diseases. This will be example of iatrogenic events. A doctor or nurse didn't wash his or her hands after touching a previous patient. This will be considered an iatrogenic infection. Second, if you are given a prescription for medication that are well known to interact with each other but you are not informed of the risk, an adverse outcome will be considered an iatrogenic effect. So, what you can do to help prevent a medical error? So, make sure to follow all the tips so then our elderly will live healthily.
Incoherence. Is lacking normal clarity or intelligibility in speech or thought, such as delirium. So, what is delirium? It is a mental disorder characterized by disturbances in consciousness, orientation, memory, thought, perception, and behavior of acute onset and fluctuating course. It develops over a short period of time and fluctuates throughout the course of the day. Who will get delirium? It is common in older people, especially when in the hospital, and about 1 in 3 older persons in the hospital will get it. There are 3 types of delirium, which are hyperactive, hypoactive, and mixed form. Hyperactive is common in elderly people. The symptoms are decreased alertness, response slowly, and slow speech. Some of the risk factors are dementia or cognitive impairment, older age, emotional distress, and sensory impairment. There are many ways to prevent. Some of them are by environmental intervention, use sleep protocol, extending visitation times, and medications. OT will help by educating patients and caregivers about delirium, improving cognition and sleep, and also focusing at improving patients' motivation. In this recent article mentioned that delirium is a common presenting symptom in older people with COVID-19. Other than that, it can also be exaggerated by healthcare policies that recommend social isolation and wearing personal protective equipment that can be less interaction with patients. Insulin resistance. Insulin resistance defined as a reduction compared to the normal range in the rate of glucose disposal elicited by a given insulin concentration. It occurs when cells of the body don't respond properly to the hormone insulin, and it can lead to type 2 diabetes. Insulin resistance is also associated with obesity, essential hypertension, non-alcoholic fatty liver disease, obstructive sleep apnea, and cancer. It also increases with aging. In people with insulin resistance, the cells are unable to use insulin effectively. When the cells cannot absorb glucose, level of the sugar will build up. But if levels are higher than usual but not high enough to indicate diabetes, doctors refer to this as prediabetes. It usually have no symptoms, but the symptoms only start to appear once it leads to secondary effects such as higher blood sugar levels. Some of the major factors that causes insulin resistance are excess weight and lack of physical activity. Some of the treatments to reduce or prevent insulin resistance are exercise, take a healthy diet, take medications, or weight loss surgery. The complications can be severe high blood sugar, heart attack, stroke, or eye problems. In this article, current data shows an increased risk of mortality in patients with diabetes mellitus and COVID-19 compared to those without diabetes mellitus. COVID-19 triggers insulin-resistant in patients, causing chronic metabolic disorders that were non-existent prior to infection.
Stop moving because we're gonna talk about immobility. So what it is? Immobility is a term used to describe a person's inability to move. And immobility can increase health risks such as cardiovascular disease and deep vein thrombosis. Immobility for elderly people often suffer from a number of diseases which worsen their mobility. Arthritis, osteoporosis, hip fracture, stroke, and Parkinson are among the most common causes of immobility of all age. Complications of immobility such as pressure ulcer, low of muscle strength, incontinence, and deep vein thrombosis can affect their performance in daily life. So these are the tips for elderly to boost motivation and keep moving. For example, improve quality of sleep, enhance self-efficacy, and positive toward change in old age.
Inanition. What is inanition? Inanition refers to a state of malnutrition and can arise from multi of causes. Based on WHO, undernutrition is common among older people over 60 years of age. The prevalence of undernutrition in older people living in the community ranges between 1.3% and 47.8%. These are the causes of inanition. Meals on wheels. Changes in appetite in elderly occurs because the loss of taste and smell, mastication problems, lifestyle changes, and also early satiety. These changes in appetite will decrease dietary intake and lead to inanition. Who's at risk of inanition? People who are at risk of inanition are older adults, people with chronic disease such as cancer, diabetes, heart disease, and chronic pain, people in hospitalization, and elderly living in nursing home. Treatment for people having inanitions include in-home support, meal delivery, community-based nutrition program, treating the underlying cause of malnutrition, changing the diet, having oral nutrition supplementary, and in some cases, tube feeding or IV nutrition. Body roles in inanitions divide into occupations, person, and also environments. Based on article Prevalence of Malnutrition and Analysis of Related Factors in Elderly Patients with COVID-19 in Wuhan, China by Yellen Zhang 2020, the prevalence of malnutrition in elderly patients with COVID-19 was high, and nutritional support should be strengthened during treatment.
The loss of the genetic giants is impoverishment. Impoverishment is defined as the process of becoming poor or the process of losing or being deprived of strength or vitality. This can also be seen as how being poor or impoverished can cause you to become sick, or how being sick can cause you to become impoverished. In this case, we will see how the elderly become impoverished due to them being sick. The main cause is due to the extensive medical care needed by the elderly to help them in living with their condition. According to WHO report in 2000, the main function of a health financing system is to protect the population against financial risk that is associated with ill health. The risks are associated with catastrophic health expenditure, which is payment for health services exceeding 40% of household disposable income after subsistence needs are met, and out-of-pocket payment, which is the direct payments made by individuals to healthcare providers at the time of service use. The increased cost of healthcare of older patients is due to the increase in the intensity of their needed medical care. This can be seen in the care of chronic condition, mental disorder, dental disease, sensory impairment, preventive care, and supportive care. C is other issues that is associated with the elderly patients, which are social isolation, loneliness, and social vulnerability. The risk factors associated with an increase of social isolation, loneliness, and social vulnerability are categorized into three types of risk factors. The first is social demographic, which is increase in age, female, low income, living in long-term care, living in isolated rural area, and living in low-income urban area. The second risk factor is medical risk factors, which includes multimorbidity, hearing and vision loss, cognitive impairment, functional impairment, and virility. And lastly is the social risk factors, which are living alone, living far from family, the lack of transportation, few friends, a caregiver of elder relatives and changes in life such as loss of spouse or moving houses.